As Doctors Without Borders launches their Tough Decisions campaign, I'm joined by MSF Dr. Mohammed Dalwai to speak a little bit more about the tough decisions he's had to make in the field. Thank you so much for joining me today.
Thank you so much for having me here.
Now, speak us through the MSF Tough Decisions campaign.
So Tough Decisions has been a campaign that MSF has launched yesterday, and we would really like to kind of increase the awareness of MSF and the activities that we do in the field to the broader South African public. And it's about highlighting the decisions that we have to make as field workers so that people in South Africa can understand the type of work that we do and what kind of decisions we face every day.
Now, let's speak about the work you do. You've served as an MSF field doctor for many years now. How did you begin?
So it started after I completed my community service. I then joined Doctors Without Borders in 2011, and I've been to a various number of countries, Pakistan, Afghanistan, Libya, Syria, Haiti, Sierra Leone, and I've been working as an emergency medical doctor in the field. It's been great, but there's also been a lot of tough decisions that you have to make in the field sometimes. Simple decisions like if you have two patients that come in and you only have one ventilator, who do you decide that gets to go onto the ventilator? It's things like that really affect you as a doctor and as a healthcare worker.
Now, you implemented the South African triage system in some of the areas that you were working. What is the South African triage system? How did you go about doing it? What was lacking in these countries?
So triage, maybe for some people that don't understand it, is a simple system of prioritization of patients. So when people come into hospitals, you have to say, okay, you're really sick, you need to be seen now. So someone with a chest pain that could have a heart attack, or maybe you're not so sick, you can wait a little bit longer. And South Africa has really pioneered triage in the developing world, and they actually have the only triage system for both adults and pediatrics in the developing world. In Pakistan, where I was working for my first mission, we found that there was a lack of triage happening, or adequate triage happening in the hospital, with patients dying waiting for care. What we then decided was, as a team, to implement the South African triage scale, which has been phenomenally successful. And MSF as an organization has now taken the triage scale and implemented it in emergency rooms across the developing world and across their projects.
What makes our triage system different to a developed country's triage system? It seems a very interesting concept.
So it's a really good question that you ask. In the developed world, there are great triage systems. There's mainly about 4 or 5 major triage systems. The problem is that they are very complex. The level of staffing you need and the amount of resources you need are much more than what we have currently in the developing world. The South African triage system actually was born in Worcester Hospital, and it kind of took into account limited resources and the ability to be implemented easily and effectively in a developing country. An example, the Manchester triage scale has something like 52 flow charts that the nurse has to know and understand. The South African triage scale has 2 charts. So that kind of thing makes it ideally suited to be able to be implemented in the developing world.
And of course in places where MSF field workers are serving.
Exactly.